athlete and her roommate are having a conversation about sleep.
Oh my god, hi Aurora.
Hey!
Guess what?
What?
I've been so productive this week. I've had a double every day, which is 6 hours of practice, and also I've been doing all my schoolwork on only 5 hours of sleep.
Oh my gosh, I don't think that's healthy. In my sleep and dreams class, we learned about how important sleep is.
I don't think it, affects me, though.
I don't know about that. Hey! I see you nodding off! Hey! I noticed you closing your eyes and nodding your head. You're sleep deprived. I learned in class that those two things are behavioral signs of drowsiness. Drowsiness is red alert.
This is true. Yawning, reduced behavioral activity, and lapses in attention are other signs. She probably just doesn't realize how tired she is because outside stimulation and her motivation to finish her work is causing her to underestimate her physiological sleepiness. As for drowsiness is red alert, the most common causes of car crashes or accidents is from people falling asleep at the wheel.
So what if I occasionally doze off? It's not like it affects me, physically or mentally.
You may think you're performing well now, but I bet you'd do a lot better if you got some extra sleep.
Studies have shown that athletes who get an adequate amount of sleep have faster reaction times, sprint times, and shot percentages in their respective sports. It is possible to see an improvement in sports performance after only 5 days of increased sleep of an hour per
I
night.
feel like it's more important, though, to do everything that I need to do on my list and sacrifice my sleep. I swear it doesn't affect me.
That's not true. It does affect you. Your body needs a certain amount of sleep every night. Sleep is a natural restorative physiological process. In fact, sleep and the immune system have a causal relationship. This means that if you don't get enough sleep, your immune system will suffer from it.
I don't know if I have time for that, though.
Did you know there's this thing called sleep debt? If you use the weekends to sleep longer, you can pay back some of the sleep debt accumulated over the week. This might help a little with your issue of time since you aren't as busy on the weekends, so you can use them to catch up on sleep.
You'll still be in debt, but that will help. You can pay back short-term acute sleep deprivation. It is even believed that the debt expires at some point, but your body just owns it. So, sleep debt proves to us that it is smart to get all sleep at once, at night.
3 days later.
Hey, so I tried getting more sleep, but I'm having trouble staying and falling asleep, and I can't quiet my thoughts before bed.
Here's what I like to do to help myself get a good night's sleep.
Learn to associate the bedroom with sleeping. To do this, minimize your time in bed to only when you are trying to sleep. This means avoid studying in your bed. Get up at the same time every day. Lock in a wake-up time, and don't hit snooze. It is also helpful to schedule thinking or worrying time. This allows you to control racing thoughts at nighttime. For sleep and athletic performance, naps are sometimes beneficial. If you want to take a nap, short naps, 20 to 30 minutes, are beneficial, and these should be taken earlier in the afternoon. You don't want to nap enough that you can't fall asleep at night, but maintaining adequate amounts of sleep and energy gives you boost throughout the day.
3 days later.
Thanks so much for the tips. They really helped.
Of course! Trouble falling asleep or staying asleep can lead to some forms of daytime impairment. It's a symptom that can become a syndrome. This is insomnia.
12 to 15% of people have chronic insomnia. Some symptoms include decreased quality of life and productivity. People with insomnia are also more likely to miss work or have work-related accidents. It can also increase your risk for coronary artery disease. Other kinds of common sleep disorders include obstructive sleep apnea. This occurs when certain muscles in your throat temporarily relax. When these muscles relax, the airway is narrowed or closed, which can cut off your breathing. Another disorder is parasomnias. This is abnormal movements, talk, emotions, and actions that happen while you're sleeping, although your bed partner might think that you're awake. Examples include sleep terrors, sleepwalking, nightmare disorder, sleep-related eating disorder, and sleep paralysis. Another disorder is restless leg syndrome. This is when you have strong, often irresistible urges to move your legs. This is usually accompanied by uncomfortable sensations. Another disorder is narcolepsy. This is the overwhelming daytime drowsiness and sudden attacks of sleep. People with narcolepsy often find it difficult to stay awake for long periods of time. The last disorder we'll be speaking about is circadian disorders. These are problems that occur when your sleep cycle and your wake cycle is not properly aligned with your environment. For example, jet lag.
Oh my god, hi Ro.
Hey!
Your sleep and dreams class is so interesting. What did you learn about today?
Oh, today I learned about the body's natural internal clock. Our circadian rhythm governs the sleep-wake cycle. I even learned about the 2 stages of sleep that we alternate between, REM and non-REM sleep. We dream during REM sleep, which is characterized by rapid eye movement, and non-REM sleep is sleeping but not dreaming.
Oh, I must be getting so much sleep then. I can dream all night long. In fact, sometimes I can sleep for 8 hours straight.
Yeah, I don't think that's true. REM is only about 20% of your sleep each night, while non-REM is the other 80%. Additionally, we only sleep for about 90 minutes at a time. Every 90 minutes, we wake up, open our eyes to check our surroundings, and make sure everything's safe.
Wait, is that why sometimes I don't sleep as well in a new place? I feel like I always have such a hard time falling asleep whenever I'm in a new place.
Yeah, I learned that the first time you sleep in a new environment, you sleep lighter in order to be aware of your novel surroundings. This is why feeling safe is a big factor for sleeping well.
One other misconception surrounding sleep is the usefulness of snooze. Many people believe that getting an extra 15 minutes of sleep in the morning is a game changer, but it's really not. REM sleep dominates the last third of the night. This means that when you hit snooze, you are actually exchanging REM sleep for light sleep.
Wait, so are you saying that instead of hitting snooze multiple times, I should just set the latest possible alarm I can and just wake up immediately?
Yeah, that's the smartest way to go. REM is important, and just like sleep, if it gets limited one night, your body will engage in REM rebound and try to make up for it the next night. However, don't think that this will allow you to catch up on sleep from a whole week in one weekend, just like we talked about with sleep debt.
So, does the time you wake up and your bedtime make a difference with your sleep?
Yeah, it's actually really beneficial to have a set sleep schedule because it allows your body's circadian rhythm to adjust and predict your schedule in order to best prepare your body for the day ahead.
Wow, I guess I didn't know as much about sleep as I thought. I'm going to use these tips every day. Thank you.
No problem. And remember,
Drowsiness is red alert.